Good morning. My name is Charlie Spearman. I am Director of Region 4 Mental Health. We're located up in North Mississippi. And on behalf of the Department of Mental Health and all the 15 community mental health regions, I'd like to say thank you for being here today to show your support for the Mississippi Public Mental Health Program. Today, our goal is to ask our legislature to give us the money that's been recommended by the Legislative Budget Committee and also some Medicaid match money for the 15 community mental health regions. We, ladies and gentlemen, it's very simple. If we don't get the money that we're requesting, there are going to be many vital services that's now being provided by the 15 community mental health regions, as well as the inpatient services that's being rendered by the Mississippi State Hospital. These services will not be readily available, and also what's going to happen, the end results of this will be that the waiting list for the state hospitals will reoccur, and there'll be lots of people sitting in jail waiting for beds in the state hospital. That's something we've fought hard for the last few years to do, and I think we've made substantial progress doing that. This morning, I'm honored. I was given a letter from Attorney General Jim Hood, and the Attorney General asked me to extend his apologies for not being here today. He had a prior commitment, but he did ask me to read the letter. The mental health budget is a severe crisis, and with February's notice of investigation by the Department of Justice, proper funding now may void costly requirements later. As Mississippi continues to struggle with economic recovery, I recognize the extraordinary challenge task that our legislature faces as they budget to provide quality services during lean years. Just 2 weeks ago, I was able to announce the AWP settlement in which some $20 million had been restored to the state coffers. I request that the legislature use some of these funds to show up the hole in the mental health budget. As Chief Legal Officer of the state of Mississippi, it is my duty to inform the legislature and the governor that the funding cuts to community mental health services proposed by the governor will likely cause the state to spend more money on mental health in the future at the direction of a federal court. As you know, the state of Mississippi and the Department of Mental Health are under investigation by the United States Department of Justice for the alleged failure to provide comprehensive community and mental health treatment programs. The governor's proposed funding cuts will make it more difficult for us to prevail in any lawsuit brought by the United States Department of Justice. It has been the experience of other states, and once the federal court begins to oversee community mental health services, these states are forced to spend much more money to satisfy the court's demand. The state would have the properly funded community mental health in the first instance. I urge the legislature and the governor not to be penny wise and dollar foolish. I'm very thankful that we have the support of our Attorney General, and again, I apologize for him not being here today. I've been given just a couple of minutes to discuss something that's been very dear to my heart, and that's the way that we deal with crisis situations here in Mississippi. Some 12 to 14 years ago, when the Department of Mental Health started talking about the idea of building crisis centers, everyone was led to believe that these crisis centers would be operated as a true crisis center. I'm sorry to report that they never have been operated as a true crisis center up till this past July. When the centers were all built, there were so many people in jail that it was the right thing to do to use them as a holding facility for the state hospitals. This has been done for the past 10 or 11 years. We at Region 4 was asked by the Department of Mental Health to operate 2 of the crisis centers, one being located in Batesville and the other one being in Corinth. These 2 crisis centers covers 19 counties. that make up the catchment area of the North Mississippi State Hospital. When we started the program in July, we had a waiting list of 78 people on the North Mississippi State's waiting list. We knew that number was going to escalate because of the fact that they were closed down during the transition period from roughly the middle of June to the middle of July. I'm happy to say, as of last Friday, we had 7 people on the waiting list of the North Mississippi State Hospital. Out of the 7 people that was waiting to bed, 2 of these people were too violent to be housed anywhere else except the jails. The other 5 people were either being provided services through the 2 crisis centers we operate or private hospitals. I love statistics. The only problem is I have a hard time remembering them. But I saw a 6 months report on all the 7 crisis centers that started in July 1 and ended December 31st. Out of that 6 months period of time, there was 1,101 admissions to the crisis center. The great part about that is virtually nobody was in jail, and only 94 of those people had to go on to be committed to the state hospitals. Ladies and gentlemen, the system is working, and we need our legislature to provide the money so we can keep providing these services. I was asked to keep my remarks very brief, but I do have one other situation that I would like to share with you. In July of 2010, the DeSoto County Board of Supervisors came to us and asked to become part of our region. Ladies and gentlemen, please keep in mind that this is the fastest growing county in the state of Mississippi. They have 163,000 population. It is the home of the largest school district in the state of Mississippi. I saw Mr. Kirkendall here earlier, and I know right now today he has 40 schools up and running. When the Board of Supervisors come to me, they said, Charlie, we have a lot of mental health needs that services we're needing from y'all, but let me tell you what the #1 service is. On any given day, ladies and gentlemen, they had 15 to 20 people sitting in jails. They probably had more commitments done in that one county than any county in the state of Mississippi. So when we got to looking at, we had to figure out where all these people were coming from. And we got to looking at it, most of these people were coming from the Baptist DeSoto Hospital. This is a very large hospital. It's located in South Haven, Mississippi, and it has 30 beds, 35 beds in the emergency department, and they have more admissions on an annual basis than any of the hospitals in Memphis, Tennessee. And a lot of those hospitals are a lot bigger. So what we done, we came up, the first thing we done, we established a crisis team consisting of 8 individuals, and the role of these crisis centers were to handle emergencies on after call, weekends, and night basis. The next thing we did, we knew all the people that went through the emergency room did not need to be inpatient. So we developed and started a intensive acute partial hospitalization program that runs there in South Haven. We realized that we had another problem because all these people were coming out of the emergency room, and we got a contract with them where Region 4 Mental Health provides staff in their emergency room 24 hours, 7 days a week. Ladies and gentlemen, this has really cut back on the number of commitments that we have in DeSoto County. Last week, Monday through Friday, we had 0 people sitting in jail waiting on a bed. On Monday, yesterday at lunch, we had 1 person sitting in jail, and before I got to Jackson, he was already transferred to one of our crisis centers. That's the way the program is working. Ladies and gentlemen, I could go on and tell you how the crisis center's working, but please take my word. We're trying to relay this message to our legislators, and we cannot afford to take a cut in funding that would eliminate these programs and these services. The state of Mississippi has too many people that has mental illness that's not being served adequately. And I have 440 staff members that works for me in Region 4. We provide a lot of services. We try to think outside the box, and we do provide a lot of services. The sad part about that is when we sit down and look at the services we're actually providing and the services that needs to be provided, we're not even scratching the surface on what needs to be done. Ladies and gentlemen, we need everybody's help here. We need our friends in education to help us today. I challenge each one of you before you leave here today to go meet with your local senators and representatives and let them know that you have an interest not only in education, but you have an interest in mental health, because really and truly they work hand to hand together. So, ladies and gentlemen, in closing, I want to again thank you for being here. Thank you for the support that you've given us. I want to thank our friends at the Department of Mental Health. We have great leadership over there. We have 15 wonderful community mental health centers, and I dare say all of them are doing an excellent job. And I think we're all pretty much operating on a shoestring budget, but we're like the gentleman said with education. We can't afford to take a cut. I realize the economy is bad. I realize the budget's tight. But ladies and gentlemen, it's time that our legislature steps up to bat and give us the money that we need to survive on.